My name is Catherine Price and I'm a physical therapist. Today I'm going to go over a routine that can address body pain or chronic pain. Before I begin, though, please consult your medical doctor or physical therapist for the appropriateness of exercises for you. These exercises are not appropriate for everybody. They, however, can be helpful with certain problems. So this routine is going to address shoulder restriction and history of shoulder pain, as well as low back pain with loss of lumbar curve, SI joint degeneration, as well as arthritic knee and ankle. So it's going to encompass a whole body approach and a variety of body parts. And to begin with, I am going to speak a word of life from Isaiah 41:10. So do not fear, for I am with you. Do not be dismayed, for I am your God. I will strengthen you and help you. I will uphold you with my righteous right hand. Amen. So pain is no fun at all, and this is going to be an approach to address chronic pain that is in the body. I like to go by the rule of thumb: release, stretch, and strengthen. So in the connective tissue, you have sensory that is going to relay that signal back to your brain. And if you have chronic tension and problems, you can end up holding chronic pain in your body. And we're going to go through and try to release that or address that. And so this is a way to manage those. So first we're going to work our way up. I'm going to start with the knee. So if you have trouble extending your knee fully, then you can have a shortening of the hamstring and the connective tissue in the hamstring. So that's where I'm going to begin. That I'm going to use a 5-inch ball. This is about the size of a softball. I want to sit in a chair and place that ball right behind my thigh. And I'm going to put pressure down into that ball. And I'm just going to roll forward and backward. And when I find an area of tenderness or tension, I'm going to hold there. And then I'm going to straighten my leg as much as I can and then relax it. Straighten and then relax it. Straighten and relax, and just finding different areas. You can spend 2 to 3 minutes doing this. You want to hold until that tension diminishes or decreases. So I'm just going to straighten and relax, straighten and relax, straighten and relax. This is actively releasing that hamstring. So when I straighten my leg, I'm getting a hamstring stretch. I'm placing pressure to release that tension. It's releasing tension in the muscle and the fascia that is wrapped around the muscle. The fascia is the connective tissue. And I can go side to side, I can go forward, and I can go backwards. And again, if you have a knee that does not straighten fully, this is where you want to work on getting that knee range of motion back and getting that knee healthy. So first we're going to release the hamstring, just releasing the tension there. And then after we release, we want to stretch. One of the ways that I like to stretch the hamstring is one leg out the door, one leg up the wall. And that allows the back to stay relaxed when we're stretching the hamstring. So after you feel like you have gotten a good release in the hamstring, you then want to, if you can safely get down onto the floor, come down onto the floor. And if you can find an area in your house that you can put one leg out to the door and then one leg up the wall. This is going to be my makeshift wall. So after I release the left hamstring, I'm then going to stretch it. So I'm going to place my left leg up the wall, and I'm going to use a leash just to work on pulling my foot back and getting a better stretch on the back of my leg. I can then take my hand and press down and just hold that. And I want to do this 3 times 1 minute, just holding that stretch and then relaxing it. So again, after you release the hamstring, you're then going to stretch it. And then after a minute is up, you want to bend your leg and then go right back into another stretch. I am going to put a timer on so that you can see what a minute is going to feel like, which is going to be a lot longer than it seems. And you can get up as close to the wall as you can and comfortably can work on getting that leg straight. And after you've achieved 90 degrees of hip flexion, you can then work on pulling that leg even closer and getting that full stretch. So this is if you've gotten past the 90 degrees where you won't need the door anymore. Okay, you're at 35 seconds. So 25 more seconds. You want to take nice deep breaths in, all the way out. And again, pushing that knee, pushing the top of the thigh to get the knee to straighten. And that is 1 minute. So I want to bend my leg and I want to come out of that stretch. And then I want to go right back in and I'm just going to hold this stretch here. Pushing on the top of my thigh. Now, if you want to relax your arms, you can just use the wall and completely just passively let that leg stretch where you're not pulling with the arms and you can stay relaxed. Again, the leash and the wall you're just going to use to help extend that knee even further. So you can see there's a little bend and then I'm pushing the leg straight. So what happens, it seems, is with a capsular pattern, you lose the extension and flexion. And when you lose that range of motion, the knee stays healthy by having movement. And if it loses that movement, it then starts to not receive the nutrition in those areas. And that can lead to a breakdown in the joint. So you want full range of motion. Okay, so that's 3 times 1 minute. Then I'm going to grab a smaller ball. I can use the softball for this next one, or I can use a smaller ball. So this is going to be a lacrosse ball, and this is going to be the 5-inch ball. So now what I want to do is I'm going to do this on both sides, is I'm just going to take my softball and I am going to roll the calf, and I'm going to go side to side. And then I'm always going to go up and down, and I'm going to find any area of tension or tenderness. Now, in the soleus, it's a postural muscle, and that's the lower part of the back of the leg, and it is contracting to keep us upright in our posture. So over time, this can be contracted and not be stretched or have the flexibility, and that can lead to chronic pain. So by addressing the fascial line, the backside, we're working on the entire anatomy train on the back side of the body that goes all the way to the low back. So I'm just going to release tension in the calf region. Now I can use a smaller lacrosse ball and get a little bit more pinpoint location on areas. And then I can take my ankle and pump it up and down to get that active release. Okay. And you can spend as much time as you need to release those areas. Then I'm going to do the same thing on the right side. So I'm going to go up and down along the calf. So the gastrocnemius is going to be higher up on the back lower leg. As I get lower, I'm getting into the soleus. That's going to be a postural muscle. If there's ankle pain, it can be beneficial to release this muscle before we stretch it. So we're just releasing the calf side to side when I find an area of tension, up and down to search for those areas, and they'll be different depending on what part is being contracted the most. Again, I like to treat based on anatomy lines and fascial lines, and this is going to address the fascial line on the superficial back line of the body. So again, that's going to be softball sized. You can also use lacrosse ball. And I'm just going to find different areas, take my foot, pump it up and down, and I am just going to release the calf, the gastroc soleus, the back side. After I've released, then I want to stretch. And I'm going to do 3 times 30 seconds calf stretch. So this is going to get the back side of the body. And just holding. On the next one, I will time the 30 seconds so you can see what that is going to be like. I'm going to switch legs and pushing that heel back. You can use a wall. You want to keep your shoulders relaxed while you're doing this. You want to take nice deep breaths. And feel a good stretch on the back side. And again, I'm going to switch. So after we have released the calf muscle, we are then going to stretch it. This is that superficial back line. It goes and it continues up into the hamstring that you just released. So we're working that anatomy train. 8 seconds, 5, 4, 3, 2, 1, and then I'm going to switch, and we'll hold this for 30 seconds. The third one is where you're going to get most of the flexibility, so I like to do stretches for 3 repetitions. And 1 minute is ideal. The 30 seconds will help to begin to get that flexibility and address some of the pain that is going to be occurring because of the stiffness. 3, 2, 1. We've got one more. And cramps can occur in the calf. So the calf is a region that you want to address. And again, your soleus is a postural muscle, so it's going to stay contracted to hold your body upright. And as we do get older, we lose dorsiflexion, which is this position of the ankle. And that puts us at risk of falling. So these are good exercises for overall health. And 15 seconds. After this, we're going to go up into the back and release the Quadratus Lumborum muscle. And I am going to, that is 30 seconds, grab a golf ball. So for this, on your back, if you go to either side and you press inward, you're looking for which side is going to be more tense, or you're feeling more muscle tension and girth, and that's where you want to then take your golf ball. So I am going to do this on the right side, and I want to, if I go, the 12th rib is a little bitty tiny rib, but I am going to go right next to that 12th rib. So I'm going to go below the rib cage. The floating 11th rib comes out to the side. The 12th rib is going to be closer to the back. I'm going to take the golf ball and I'm going to place it right there at that 12th rib, and then I'm going to lie onto my back. That's going to put pressure on that Quadratus Lumborum muscle. I'm then going to bring my knee up the side that I have the golf ball, and I'm going to rotate to that side, and I should just feel pressure on that muscle belly. So the quadratus lumborum muscle is a big culprit with low back pain, and it's got 3 different branches to it, and you can go down lower, so I can take that golf ball, stay on my low back, go inwards towards the spine, and still rock over to the side and address different areas. And so I am just releasing the tension on the quadratus lumborum muscle. And I want to do that until I feel that there is tension release in that muscle. This muscle, if there's trigger points, can refer down into the buttocks region and can cause other back pain areas. Now, the quadratus lumborum, it's a muscle that needs to be released and stretched, but because it is a postural muscle, it's usually overcontracted, and so it's not one that needs to be strengthened. So after that is released, I'm then going to take my arms, go into a Y position or behind my head, and then I'm going to cross my left over my right, and I'm going to go over to the left, and that is going to stretch my right QL, my right quadratus lumborum. And I want to hold this stretch because my right side is the one I released. I want to spend longer time on that side. So I will, on your tight side, I would spend 1 minute, and then I would do both sides to balance, and you can spend 30 seconds on the side that seems to be easy. And if they both seem pretty equal, then you can spend the same amount of time. And if there is no tension in that area, then it's not necessary to release the muscle. So this is going to be halfway there. And then I'll switch to the other side. Okay. 5, 4, 3, 2, 1. And then I'm going to cross my right over my left. And I'm going to go over to the right. And here I am going to hold for just 30 seconds. And again, arms are up because that is going to allow for more of a stretch to occur down into the quadratus lumborum muscle. This is a good way to get spine mobility without putting the compression on the back by extending it. And that's 30 seconds, uncross, and then left over right, going to the left to stretch the right side. And I'm going to hold that. And I will hold this side for a minute, and then my left side for 30 seconds. And so for the anatomy train, so we worked on the left hamstring, going up into the deep back line. It then crosses over to the right side. So that all is on one track in the fascial system. And again, if you have a therapist that can examine you, you can get feedback on where your tension is and what is going to serve you best for where you spend your time. All right, 15 more seconds. 5, 4, 3, 2, 1, and uncross, right over the left, and going to the left and holding right here. And again, you're going to have one side be more ease than the other if there is difference in tension from one side to the other. That's 30 seconds, and left over right, and going left. All right, so after the cue out, then I want to roll the lats. The lats are key for low back because the lats are going to attach right at that thoracolumbar junction into the thoracodorsal fascia on the low back. And so if you've got shoulder restriction, that is going to affect the back. So I'm going to roll the lats next, and I'm going to do both sides. So to roll the lats, I'm going to go along the edge of my shoulder blade all the way up to the armpit, coming down along the edge of the rib cage and angling backwards. And again, that muscle goes all the way down to the lower thoracic region and attaches to the thoracodorsal fascia, which is the low part of the back. So you can just work on mobilizing the latissimus dorsi tissue by rolling the side. And if you find an area of tenderness, you can hold there until it decreases. And so I'm going to spend 2 or 3 minutes doing this. For sake of time, I'm going to move along to the other side, and it's going to be the same. I'm going to go along the edge of the shoulder blade up into the armpit and mobilize the connective tissue and muscle down the side of the rib cage, and I can rock back to get more muscle belly and rolling all the way up. If one side is tighter than the other, you can spend time on that side. All right. So take as much time as you need to on these. After you have rolled, released the tension, then you are going to stretch. And this is going to be, again, it's a 3-time 1-minute stretch. And this is going to be sufficient, is just to do a shoulder flexion stretch and hold this. Taking deep breaths in all the way out. Deep breath in, all the way out. And you should already start to feel like you're getting some loosening in areas. With this, you can also get a stretch on the back of the leg and the hamstrings, depending on how tight. And over time, this should get less and less. 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax out of that. You can roll your shoulders. You just want to take a deep breath and going right back into it, dropping your chest down. Take a deep breath in, all the way out. Deep breath in. Deep breath in. Halfway there. Deep breath in. Seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Roll your shoulders. And then going right back in for the last stretch. Dropping the chest down. next we're going to go down into the hip region. So this is going to be the tensor fascia lata. So we're going to roll, we're going to release the tension that's going to be on the muscle that's on the front side of the hip. It's attached to the IT band that goes down the side of the leg. And to do that, I'm going to come onto my, angled onto my side. So I'm going to be on that front of my hip. I'm going to take my knee and rest it on the roller, and I'm just going to roll high on that hip. And if there's an area of tenderness or tension, I want to hold there, and I can then bend my knee to further actively release that to get a stretch, and then straighten. And again, I'm staying high on that area. And you just, any spot of tenderness, hold and see if you can get it to decrease. So this is going to be the tensor fascia lata. If there are trigger points there, this is a culprit for low back pain. And so this is going to be part of the front line that we're releasing now. So right now I'm releasing the right tensor fascia lata. I should feel the tenderness on the front of the right hip. And I can keep the leg straight. As I bend it, you should feel it intensify. And then straighten. So when I release that, I'm going to switch to the other side. Same thing, I'm going to come right on that front side, place it onto the roller, rest my opposite knee on the other side, and I'm going to stay right up here high in the hip. Same thing, I'm going to bend that knee to intensify the release. And then straighten, bend, and then straighten, just holding that to release the tension. And if one side feels more tense than the other, spend more time on that. And just spend what time you need to do this. It usually takes 2 or 3 minutes. 2 or 3 minutes depending on how chronic and how much tension. After I have released the tensor fascia, I'm going to go into a stretch, and I'm going to start with a half kneel stretch. So I'm going to put one leg forward, one leg back, and then I'm just going to lean forward, and I want to feel the stretch on the very front of the hip that's on the back leg. And I just want to hold this stretch. You want to hold this for 30 seconds. And then alternate, bring that the front leg back, and then switch to the other side and hold that right there. And then you should feel a stretch on the front of the back leg. So for the sake of time, I'm going to go through these a bit quicker just to demonstrate. And so I'm just going to switch again, leaning forward, and you can use something for balance. Getting that nice, as you feel like you can, you want to sink down. You don't want to arch your back real far back. You just want to sink down. We don't want to have compression in the back. We're just stretching the front line. And then alternating, shifting, and do not let the knee go past your toe. You want the knee to stay in line with the second toe or the foot. You don't want it going past and straining the knee. And then switching, getting a stretch on the front of that hip. And switching. So 3 times 30 seconds on the half kneel stretch. After that, I want to go into then a lizard stretch. And that's where I'm going to bring my arms down. So I'm going to put right leg forward, left leg back. This may be where you you can use blocks to put your hands on, and then you're just working your way down. And this is going to stretch the inner thigh of the leg that is forward. And so you're going to feel those stretch differently. And then I'm going to alternate and bring the other leg forward and dropping down. And holding for 30 seconds on these as well, so just alternating back and forth. And I'm just going to shorten for time. And dropping down. Hold this for 30 seconds. Again, you may want to pause because I'm going through these fast. And over time, you should feel that this is going to become more symmetrical. And especially after we get into the hip releases, which is going to be next. And the last one with the left leg forward. And by the time you get to your third stretch, you should feel loose. Okay. Now we're going to get into 2 glute releases. And the first one is going to be the butterfly release. So I'm going to go use my softball. Now, you're going to come to your hip. I'm going to feel a bony part stick out the back side. Then I'm going to come to the side. I'm going to feel a bony portion sticking out here. If I go at a diagonal, I'm going to find the space right in between, and that's where I'm going to place this softball. And this is going to be on my side. So I'm going to take that, place, so it's about, if you go an inch down into the side from that bony spot on the very back of the low part of the back, that is where you're going to place the ball. And then you're going to take the bottom leg and pump your knee up and down. And so you're just releasing the tension on that area. Then I'm going to switch to the other side. And I'm going to take same thing. I'm going to find the top of my hip bone, come to the back. There's a little bony portion. Then there's an outer bony prominence here, the greater trochanter. So I'm going to go at a diagonal about an inch down and out from that. And I'm going to take that softball and I'm going to go onto that side and use your hands for balance. And then you're taking the bottom knee and you're pumping that knee up and down to release the tension there. So here you want to do both sides. Again, if one side is more tender or tense, you want to spend longer time there. Release that area. Then I'm going to go right into the glute medius. So the glute medius, you're going to find the top of the hip bone, the top of the iliac crest, and then you're going to have that bony portion, greater trochanter. Just above that or below the crest, that's where you're going to place the lacrosse ball in between there. So you got your glute med and your medius. And for this one, you're going to lie directly on your side. The leg's going to be behind the other one, and then you're going to be directly lying flat. It is different when you take the tension off versus placing the tension on. And you're going to go an inch forward and an inch back and just release that glute medius muscle. And then after that, I'm going to switch to the other side. Same thing, top of the crest, bony prominence on the outside, coming in between there, that's where the lacrosse ball is going to be placed. Going directly onto my side. The bottom leg is straight, the top leg is rested behind, and I'm just going to rock an inch forward and an inch back, and I'm going to release the tension there. Now, if you want to add the active release part, you can then try to pull that knee up and then straighten it back out, and that should intensify that area. This is usually pretty tense just to begin without even movement, but as you get the tension and tenderness to subside, you can start to add more of the active release. After you've done the active release, you then want to do the stretch, and that's going to be opposite knee to opposite shoulder. And so you can bring that knee across and then switch and bring the other side across. Now you can also go into a figure 4 stretch, and this is going to stretch some of the area that you've also released as well. So you can do a combination of knee to shoulder stretch, or you can do the figure 4 stretch, and you're just you are utilizing the release and the tension and then stretching. And then I'll go back to opposite knee to opposite shoulder. You can spend anywhere from 30 seconds to a minute on these stretches. And so that's going to be my release and stretch of those. Then we're going to get into the strengthening phase. So the strengthening, the first thing, and these are only if you, planks are okay if they're done correctly. And the biggest part about a plank is making sure that you're using your buttocks muscle. So I'm going to go up into plank, but I'm going to really squeeze my buttocks tightly. So I'm squeezing my butt. If I feel my butt relax or not stabilizing the back, then I'm done with my plank. So you're going to feel the core, the front. You're going to feel the abdominals working to hold, but you should feel more buttocks working than low back working. The low back, if you start to feel strain there, then you're done with the plank. So 30-second hold, and then I'm going to relax out of that. Take a nice deep breath in. And then I'm going to go back up into a plank. Again, squeezing my buttocks tightly. The glute max is the largest muscle in the body, and it is a big stabilizer for the low back. And so if the buttocks is contracted, then it will stabilize the back. And cultures that have little to no back pain have very strong glute max muscles. So the glute max is important for addressing low back pain. 3, 2, 1. And relax. Deep breath in. Going back up for another plank. Making sure that I'm squeezing my buttocks tightly. Holding that. If you start to feel any kind of low back discomfort or pain, then you're done. No more. You can build up to doing 4 sets. That's what we're going to do is 4 sets. Start with 1. You can add another as you get stronger and stronger, and you're able to continue stabilizing the back. You can increase. And planks you can have discomfort in the back the next day if they are done incorrectly. So that is one thing to be aware of. And you want to squeeze your glutes tightly. You don't want to drop the back down. I don't want my back arching. I don't want to be way up. I want to squeeze my butt and keep as straight of a line as possible. Halfway there. And 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. All right, so that's going to be some beginning of the core. And then I want to start some isometric abduction, adduction to work on core as well as addressing SI. So what I'm going to do is I'm going to take a belt. You want something that has no give to it. And I'm going to place it around my knee. And the first thing I'm going to do is I'm just going to squeeze my buttocks and push my knees apart. Hold for 5 counts. 1, 2, 3, 4, 5. Relax. I'm going to squeeze my butt, push the knees apart. 2, 3, 4, 5. Relax. I'm going to squeeze my buttocks, push my knees apart, and relax. Squeeze and press the knees apart, and relax. Squeeze my buttocks, push my knees apart, and this should feel good to the low back. And relax. Squeeze the buttocks, push your knees apart, relax, squeeze and press. You can even draw your navel into your spine to contract the abdominals. Relax, and 2 more. Push the knees apart. 2, 3, 4, 5. Relax. And last one, squeezing my buttocks and pushing my knees apart. 2, 3, 4, 5. Relax. Then I'm going to, I can use the foam roller between the knees or just anything that is firm. I'm then going to squeeze my butt. So as I squeeze my butt, my hips should tilt backwards, and then I'm going to push my knees in and hold for a count of 5, 2, 3, 4, 5. Relax. Squeeze my butt, push my knees in. 2, 3, 4, 5. Relax. Squeeze your butt, push in. 2, 3, 4, 5. Relax. Squeeze, press your knees in. 2, 3, 4, 5. Relax. Squeeze, press in. 2, 3, 4, 5. Relax. Squeeze, push your knees in. 2, 3, 4, 5. Relax. Squeeze your butt, push your knees in. 2, 3, 4, 5. Relax. Squeeze, press in. 2, 3, 4, 5. Relax. Again, it should feel good to the low back. Press. 2, 3, 4, 5. Relax. And again, press. 2, 3, 4, 5, and relax. So now what I'm going to do, and so that I'm going to do an alternation between adduction, abduction. So now I'm going to grab the roller. I'm going to place my feet on the roller. You can put the roller up against the wall in order to keep it from moving, or you can just use a stack of books or a step to put your feet up on. You just want to get them elevated. I'm then going to push my knees apart, squeeze my buttocks, and I'm going to lift up and then come right back down. And I'm going to do this for a count of 10. So I'm going to squeeze and lift. 2, back down. 3, back down. 4, it should feel good to the back. 5, back down. 6, back down. 7, back down. 8, back down. 9, back down, and 10. And then I'm going to alternate. I'm going to then place either my foam roller or an object that doesn't have any give. So I'm going to use a basketball. And then I'm going to squeeze my buttocks and then squeeze my knees in and lift. 1, 2, 3. Inhale, exhale. 4, 5. It should feel good to the back. 6, 7, 8, 9, last one, and 10. And then alternating for one more set. I'm going to use my belt, push the knees apart, and squeezing my buttocks, lifting 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10, and then I'm going to switch for the last time, placing the basketball or use my foam roller, squeezing my knees in, squeezing my butt. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. And that completes some SI stabilization and core strength. So this was a release, stretch, and strengthen to address chronic pain that can occur in multiple areas of the body. I hope this was of help, and have a blessed day. Thank you.